Welcome. So this session is about microclimate, and I'm going to talk a little bit about how can the microclimate of seats for wheelchair improve pressure release in general and support a better health for the end user. So I'm from Created Realm. I'm Jeremie Gay, the founder of the company and CTO, and we've developed a technology called Programmable Foam. Programmable Foam is a technology that allows us to 3D print with a soft TPU seats for wheelchairs or insoles, and you can create things where it's soft in one side and hard in another side, and that we can use to create pressure relief applications. So first, a little bit about microclimate. In general, when you are designing a seats for wheelchair, what you want to avoid is pressure. So pressure wounds are the worst possible thing, and pressure wounds comes from a mix of three different things. So it's of course the big applied pressure in areas that are bony, but it's also the microclimate and shear. So those three factors are the risk factors that accelerate pressure wound. So when we started to look into how can we use our technology to help end users, we focused a lot on pressure. And then we allowed to create seats for wheelchair where you have different zones. So every color that you see on this picture is actually representing a different hardness of the seat. So we can actually print seats for wheelchair with programmable foam where the different hardness have different function. So some harness are used for positioning, some other harness are used for comfort, and some other ones for relieving specific pressure point. When we introduced this technology, we also realized that it's not just about the pressure. There were some huge advantages coming with it. So the technology that we have allows actually to create those soft and hard zones, but also between two zones to create a gradient transition. Because if you don't have this gradient transition, then it's not comfortable. People have been doing this by hand, by cutting foam and gluing it together, but then between two zones you have this hard area, and that doesn't work. Or if you are really skilled, you need to spend a lot of time to actually get a good result by combining those different foam harness. Here you can do everything digitally. In the software, you can choose the area, and then automatically a gradient is generated between those areas. So we have a number of patterns on this technology, but in short, the principle is that we control the volumetric density. So we have less material per area, and that makes it softer. So let's go back to the clinical risk factors. So you have the pressure and the microclimate. When we introduced this initially for the pressure, we realized that there were a lot of advantages of having a structure that can breathe, where air can circulate. And then we decided to actually test around this concept. So what we could see with programmable foam is that we could really reduce the temperature at the interface skin seats, and that allows to have a much more healthy environment for the skin. What we see is that most traditional foam have a temperature around 35 degrees at the interface, and it really should not be more than 33 degrees. And with programmable foam, just by having the open structure, we can get under the 33 degrees that are critical. It's also, the material is non-absorbing, so you don't have those build-up of bacteria or fungus, and it's also possible to wash it. So the washing is also very important because you can keep your seat device much longer and have the microclimate much more healthy. We've tested with Pittsburgh University, which is actually the world specialist into all those ISO standards on seats for wheelchair, and this is the result that we get in terms of the temperature, also on the humidity. I'll come back to that later. We can lower the humidity level also, which is also something that helps the growth of fungus and bacteria. How does it work? Well, it's pretty simple. You can see the gyroid structure is open cell. So of course you need to think a little bit about it when you create the cover to let the airflow go through, but it means that you are basically sitting on air. Previously, in seats for wheelchair, people were sitting on air pocket, but then it's very close and you still have this very tight interface with the skin that doesn't allow the breathability. Here you can actually reduce that temperature and create a much more sane environment. You have a lot of cases around those big molded seats where people are actually sweating quite a lot, and this is really difficult because once you sweat, everything accelerates. So you have this the temperature rise, you sweat, and there's more friction. It just amplificates everything. So it's all about keeping those risk factors as low as possible, and then allowing this environment to be more easy. When we looked at the actual microclimate, and the user, they stay in their seats for like 8 to 14 hours a day, and pressure injury are caused by the fact that all those risk factors are combined together. So every time you can reduce one of them, you actually reduce all of them. So we see that literature around pressure wound is very focusing right now on microclimate. They've looked a lot into pressure wound based by pure pressure, but now they look a lot in microclimate because they can see it's a huge contributing factor. There's also things around the stability of the seats and transfer from seats to bed that can play roles. So it's also the literature focused on that. But the fact is that we gather a lot of feedback from users and professionals, and then we created a list of requirements. So what is the ideal seat? Well, it's a seat that can allow this precise pressure distribution. So per individual, you can actually make something completely custom. So this is done with using a bean bag where you position the patient. You can also use a pressure mat where you can see specific pressure point, and then into a software you can go and then counterbalance for it and create areas that are softer. But it's a real balance because we also need to make it stable enough so that it will collapse. It's just not enough to just make it softer. You need to make it softer at the right place while balancing the right structure. The big thing also is that you can take an entire seat and put it in the washing machine. So this, you can wash it at 60 degrees. You can also just grab the seat if it's really big and you don't have such a big washing machine. You can put it in the bathtub and just rinse it. So it really also makes a big difference for personnel that take care of patients, that they can easily remove it and wash it. So I don't know if you've seen some of the foam seats. They often need rework because the foam is usually painted to isolate from incontinence, and then you need to kind of repaint it regularly. But if it gets inside, then it's a biohazard. So here you don't have this problem. You can just regularly rinse it and then keep it in a very good condition and have this very healthy environment on the microclimate. Yes, the thing is also that I don't go in detail about all the customization, but obviously the seat is made for every individual, and the fact that you can both play with the shape of the seat to create the positioning, but the harness inside gives you a lot of tools. So it's not imposing any technique. It's still the same craftsmanship that people have been having for many years, but now they have another tool that makes them much more powerful into what they can do. And it's all about being able to go from the craftsmanship that people have done with their hands and to move that digitally. Once you can do it digitally, then it's very scalable. You can actually have a much higher throughput, a better work environment also, because everything is automated on a printer. I brought this seat here. It's one of the most advanced that we have because we also started to put more elements into it. You can see that we don't even have a backrest on this seat. So here we are putting like hard zones into it, and you can print the entire thing in one go. So you can come and see it afterwards. We have some elements also where we can screw into it and attach directly into the seat. So it means that the cushion and the wheelchair becomes much more integrated, and that gives you a lot more freedom onto the design. So it's just a very powerful tool that you can use for the patient, but also to optimize a lot of things around the seat itself. We have a partner called LCS that has gone a bit farther into it. So by design, the structure is open, and those open cells allow the flow to go through, where you can blow some air actively into the seat, and then you can even lower further the temperature. So they did the exact same test that we did with Pittsburgh University, and through the temperature and the humidity, and they could go even further. So for extreme cases, this is quite recommended. You need to consider a little bit the cover. So they have made a special cover that allows the air to be guided exactly where they want it. And that also made a big difference. So this company has been actually looking for a solution like this for many, many years. They've tried everything through foam to drill into it, and nothing worked, because you would then create like cold spots that are not working ideally. But with programmable foam, that worked from almost from the first try, so that was a great success. Yes, so the washability, it's a big thing. So you can see that in a hospital, they usually have those big washing machines. You just throw it in the washing machine. We hear from the personnel that it's much easier to take care of patients. Often they put an incontinence a serviette under the seat, and then they just need to take it off and rinse it if there's some problems. So a lot of people, they don't feel anything under the waist, so this happens quite a lot. So it's really a game changer that you can do that, and then it dries very fast, so you're back in your chair quite quickly. Yes, so a little bit around the hardness. So we have made a software. We come from the 3D printing world, but what we do is that we build everything into a solution, and we make it easy for people that are not in 3D printing to have 3D printing experts results. So we actually boil it down to 5 hardness, and then you can easily, on the software, position area or paint on it, and then you create your seat in 5 minutes. You can have a seat with the custom hardness into it. Our strategy, because we come from 3D printing, when we stepped into this, we thought, okay, we need to change our mindset. We've been developing software, slicing software for 3D printers for many years, and this slicing software is very specific, very broad. It can do a lot of things. And then when we came into this market in the UNB, we said, okay, we need to look at it differently. So we started from the device. We started with insole, then we went for seat, corset, now sockets. And every time we step into it, then we go all in. So I'm going to show you some of the things we've done for seats around programmable foam, and why we are confident that it's a good tool. So there is some ISO standard on seats for wheelchair. So the ISO 16840. We've tested according to 10 different tests that we've done around this ISO. So we could actually confirm that we could control those temperature, and it's very important for the MDR, the medical device regulation, that if you bring something that is 3D printed, you need to kind of validate the entire process. So we have the printer, we have the software, we have the material, and everything is certified, and everything makes sense together, and then you almost have all your documentation for the MDR that is resolved. We also have made some studies and stuff. So when we started, we were wondering how could we quickly bring enough confidence. So what we did was to look a lot on risk factors, and then we did performance tests to see that this could reduce those risk factors. So we tested the material itself. So the material is biocompatible. So to the ISO 10993. So this is skin contact, skin irritation, and also cell contact. So in theory, you can implant that into your body. That was not the purpose, but we were a bit paranoid, because we were thinking, okay, what happens if you sweat and then you have contact? So the sweat will make a contact to skin, and could things come back? So we really wanted to check everything. We also did some fire tests. There is some specific ISO standard also for fire on a wheelchair. So if someone is smoking or something like this. And the material is actually really good against fire without using any additives. Normally in foam you have additives that delay the fire start. And I think the test is it needs to hold to 14 seconds, but you can count, and when you hit 15, then it just bursts in flame, because they only put the number of additives that is necessary to pass the test. Here it doesn't burst into flame, it just melts, and it's much safer product when you have a smoking user. We did a lot of tests in-house. So we looked into, how does stain stays. So this is linked to as the material absorb liquid. We tested, can it be washed? We made a lot of internal tests, but then we thought it's not enough, so we went on and then we did a lot of tests with Pittsburgh University. So those are much more linked to the ISO standard. So we tested the washability, the immersion. So this is how much you get into the seats of the wheelchair. Of course, it depends on the design. You can play with the hardness, and that will affect the performance of your seat. We also tested for impact damping. Impact damping is a test simulating for going down from a sidewalk. Then you get a shock. And this material is extremely good for shock absorption. So that we got extremely good result. Pressure mapping, of course, it's since you are really this tool, you can control the hardness. You can really design something that reduces the pressure. We tested for envelopment, so again pressure and immersion. We did all those tests, and then we did a durability test. So what was done was an accelerated aging. So we took the seat and then it was compressed 17,500 times, and it was washed in the machine, and then we redid the entire set of tests. So for all the tests, we have data before aging and after aging. And then we can see that it's much more durable than normal foam. So this is the result on the temperature and humidity. The pink one is programmable foam, and then the other ones are some reference seats. So Pittsburgh University always has a number of seats that they have tested themselves, and then you can compare your result to a pool of seats. So you can see that in temperature we are much lower, and in humidity we also get under around the 60% of humidity, which is actually you need to be under 65%. And most seats actually are basically creating an environment that is that's too much moisture and that is too hot. And this is not always directly creating the pressure wound, but it accelerates the formation of pressure wound. Yeah, so in general, the material, it's a combination. So here there's a lot of factors, and you need to know how to take advantage of those factors. You see on this picture, we are comparing the permeability of it. So traditional foam and paper under it is not going through. This programmable foam is just completely open. It's like being sitting on a cloud. It's like really open. I mentioned before that it's quite important to think of the cover that you use. So some of the tests we did with Pittsburgh, we also integrated a cover that had a little bit of cushioning into it, but we also play with the cushioning in pressure to create the extra soft in the top of the seat. So when you see something like this, you think, okay, it's printed in one thing, but here we're actually mixing the 5 hardnesses together. So these are some of our cases. We have Esther, so she has a long-term sitting orthosis, and she had the costoliac impingement. So it means that she had a big issue of positioning and pain into the side. So one of the things was to position her correctly within the seat, and you can do that because some of the harnesses are hard enough to push you gently, and then you can create layers of softer harnesses to create a cushion, so it's not too aggressive on the user. And this is after and with the new seat. You can see that she's very well aligned. This is Henry. So Henry is 18 years old, and he's spastic tetraparesis. So he has the C-shaped scoliosis basically, and so he also has a problem of positioning and then pressure wound quite regularly. You can see right now the picture before, and you can see after how well aligned he is into the seat. Actually, those cases are in Germany. They have this group of parents that are communicating together. So now we had, I think, 5 cases that are extremely successful. So now the parents are talking together, and everybody wants to move to this technology. I just want to say that programmable foam is just a technology. It's of course combined with people's craftsmanship and their know-how, but it's extremely powerful, and it really opened the door for a better patient care. Yes, thank you.